Sheena's Place has been absolutely fabulous because what it's done is it's created a hub for people to be able to come as they need. They can come, they can go, and
it's different than walking into your doctor's office. It's different than going to a one-on-one therapy session. It's different than going to a hospital-based program. It is out of a house.
They know what they're going to get here. They're going to get hope and support. They're going to get informed and aware facilitators. They're going to get a very clear, structured approach to understanding that that they're okay, they're accepted for who and where they're at in terms of their recovery. They're not going to be judged, and as such, you can only imagine what it's like for people with eating disorders in the community where they're misunderstood.
Perhaps people feel less under a microscope when they're here because they feel like they're sitting in a living room. They're not sitting in an office. They're not in the therapy chair. They're here and we're all humans sitting together supporting each other.
I loved that it was a home, because that's how it made you feel, you know? You weren't walking into a sterile, institutional spot. You know, you were walking into a place that gave you that sense of being a community-based support.
I think we've had lots of participants say that just by this group existing, they feel like they can now see themselves in a recovery conversation. These are people who for years and years have had their experience but just never saw themselves represented in a mental health space.
I see like community blossoming in these groups. I see folks coming to Sheena's Place and all of a sudden having a space to talk about, you know, their transness and their eating disorder, like the chronic illness, the disability, and eating disorder experiences. And so often folks are like, I have nowhere else to talk about these intersections. I think having that community like allows people to actually engage with recovery in a way that's meaningful and actually be able to address more of the issues that are like actually relevant to why the eating disorder is going on in people's lives. Because we can actually address the transphobia, the ableism, the racism, the sexism that's happening in people's lives and really like impacting eating disorder stuff, behaviors, symptoms that like just isn't addressed in a lot of clinical programs.
We really, as an organization, value the individual experience of folks with eating disorders, the resilience that folks bring with them when they arrive here. We really try to interact with folks without judgment, and we really value community. The opportunity for folks to connect with us and to connect with each other is such a key ingredient to the work that's being done here.
To reach as many individuals that are struggling with eating disorders as possible, and I think Sheena's does an absolutely remarkable job, both at reaching out to those individuals that are struggling and also the programming that is done within this organization.
My name is Kelsey Johnston, and I'm the program manager at Sheena's Place and also one of our group facilitators. We've been around for 25 years, and obviously there's been lots of change in that time, but I think one of the things that seems to have always been a really important piece is the community, getting feedback from the community, incorporating community needs into decision making. We care about our community members, we care about inclusion, and as much as we try to offer, folks also offer when they come to our space, they offer support and compassion to each other.
Zac Grant, group facilitator at Sheena's Place, a registered social worker. So I first kind of got involved in eating disorder communities because I was experiencing my own eating disorder. And I found it like kind of challenging to navigate that outside of like formal like supports in hospitals. I had joined a lot of online forums for like trans folks with eating disorders when I was looking for support. I kept noticing folks, like trans folks, saying, where are the supports for us? Like, where are the resources? And so I contacted Sheena's Place and said, hey, I have this idea for this like trans non-binary gender questioning support group. Would you folks be open to me facilitating that? And luckily they were really on board with that and said it was something that they had been receiving requests for. They wanted a trans facilitator, someone who understood eating disorder, someone who had, who was a social worker or a clinician of some sort.
For about the last 15 years, I've been running an evening group for caregivers of people with eating disorders. The group is fantastic. People come on behalf of themselves and their loved ones. The group is best run when there's like 20 people max in the group because people's needs can't be heard and addressed.
We started with a workshop in summer 2019 called What's Color Got to Do with It? Exploring Racism and Shadeism in terms of an eating disorder experience. And when we came, the participants were lovely. All of them were like, could this be an ongoing support group? And in June 2020, when I think the conversation around social justice and race and identity and mental health was at its highest that it's been, at least in our like North American context, we were like, even though it's a global pandemic, just given the stress that this community is under, maybe this is the time that we do something about it. It's the only right now BIPOC support group in Canada for people of color, or Black or Indigenous, to have a space to talk about their eating disorder experience and how it intersects with their mental health.
I'm Choi, the Executive Director at Sheena's Place. When I was being interviewed for the position, the pandemic was early on, and the organization was starting to make the shift to online services. There's an even a greater focus on trying to increase accessibility for a broader range of individuals to access services.
One of the things that's happened as a result of COVID and our groups having to move online, the Family, Friends and Partners Support Group, we now have people coming from all over Ontario.
One of our long-term goals was being able to offer some programs online, and so COVID was kind of the catalyst for getting that project underway. So we've expanded our groups, and it's been a great opportunity to reach other people that we wouldn't have been able to reach before through in-person groups at our physical location.
In EDA, Eating Disorders Awareness Week 2019, the theme was Eating Disorders Can't Afford to Wait. And when you think about how the pandemic has impacted people's understanding of eating disorders and the way they're impacted by them, I feel like we've only seen those gaps become earthquakes, where those who are most vulnerable have often been impacted the most by it. And so to think about whether support is actually changing for communities is a bigger question where we have to tease out these systemic constructs from this.
We also know that eating disorders and eating problems are inextricably linked to social inequity, and people's experiences of violence and food insecurity and housing insecurity and, lack of access to education. Places like Sheena's Place are just really important because those are the kinds of issues that you all are willing and able to talk about. And I think that for people who are at a stage where they may not be able to subscribe to a hospital, they may not be able to subscribe to an institution in that sense, this is also an opportunity for them to get well-meaning support that is also rooted in research.
I would say that we've seen an increase in acceptance of mental health disorders as health concerns over the past maybe couple of decades. There's just a broader acceptance that mental health is a concern for literally everybody. There are certain aspects of mental health or certain disorders that have traditionally been sort of less attended to, and eating disorders would absolutely fall in that category. The conditions surrounding the pandemic have really sort of accentuated the risks that folks are maybe facing.
On February 1st, when I held, Ontario's first eating disorders roundtable, because my Bill 61 had passed, a bill which granted was a start and really just about getting awareness, raising awareness, having something on the books, quite frankly, so that whether it's me in future years or another MPP in my seat in future years or anybody in the legislature can go back and say, in 2020, on December 8th, Ontario took eating disorders seriously, and now we can build.